Wash my hands about 10 million times a day. Keep my hands out of the mouth. If somebody's coughing, I hold my breath as long as I can.
Doctors' offices like the O'Connor Medical Group in Orchard Park are now the front lines in the battle against the flu epidemic.
We've actually had increasing cases of influenza. Yesterday we had a ton of cases of influenza.
But with so many sick people coming in, it can be hard for staff to protect themselves.
A Clorox wipe, and I wiped down my stethoscope after every patient, or an alcohol pad if it's not someone who had influenza, and wiped down my computer.
Policies and procedures have been implemented to prevent the spread of germs, but the reality is flu germs can live for a long time.
It can live on surfaces. It looks on average about 24 hours on a surface or a contaminated object.
But what about patients? Should you skip the doctor's office and use telemedicine instead?
Time is not on your side. This is something that the sooner the better to get some sort of triage about what to do, to get early diagnosis and treatment.
Thanks to advances in technology, companies like MD Live, Doctor on Demand, and Teledoc can use video connections so doctors can diagnose and treat patients remotely.
We do in excess of 8,000 visits on some days. And well over 1,000 of those on some of those days are influenza-related illnesses.
Telemedicine can provide guidance to people who either don't have or cannot get a hold of their primary care doctor.
It's helpful if they have questions or concerns and they're just thinking about whether or not they need to seek more care.
But it is not a substitute for seeing a doctor in person, especially if you think you have the influenza virus.
If you're really sick, you need to be seen. It's usually not the flu that kills people, it's the pneumonias that get afterwards. And there's no way you can figure out someone has a pneumonia over the phone. You need to see them in person.
Ed Riley, 7 Eyewitness News.